Hey everyone, in my latest podcast, we sit down with the CEO of a company that trades on the NASDAQ and has over $75 million in cash runway, which makes this a long-term solution possibly within the psychedelic industry. And they're about to launch in-home ketamine treatment. Yes. So how will this work and how effective will it be? Find out now in our latest conversation. Hey everyone, this is the Dales Report, and I'm happy to be joined back to the podcast the CEO of Field Trip, Ronan Levy. It's been a few months, but how are things?
I'm doing all right. It's a crazy world and crazy times across a number of different arenas in
You
life.
think?
We're making do. We're making do.
Well, it's good to see that you're doing good. I know it's been challenging times to say the least, especially within this industry. But for the most part, how is the company been making out? You personally as well, with regards to the industry itself, because I think since the last time we spoke, which is probably 6-7 months ago, things looked completely different from what they are now. We're definitely seeing a lot of subtraction of companies within this space, but are you surprised at all in how much change has happened in such a short period of time for the industry?
Yeah, I thought we were going to have a little bit more of a honeymoon period with the markets, for sure. I
Yeah,
thought we'd have a little bit more of a longer period, kind of akin to what we saw with cannabis, which had ups and downs, but I don't think it had this level of as quickly and severe kind of decline. Um, but we're doing well. I mean, we raised a lot of capital. We were very
yeah.
conscious. It's one of the lessons we took from the cannabis industry that the windows for financing open and close. And in the words of Vic Neufeld from Afria, his piece of advice that I always took to heart, which was rain or snow, take the dough. We made sure we filled our coffers when the markets were good, and so we're well positioned
Yeah.
um, to continue to thrive. Um, I think what's really unique about Field Trip is that we're positioned to be a part of the psychedelic industry. We were just chatting before we came online about how some people are trying to reframe the psychedelic industry as a biotech for mental health.
Right. Yeah,
I
of
think that's
course.
accurate, but I don't think that's the complete picture. Psychedelics have been referred to as the worst kept secret in corporate America. These are
Hmm.
things that are becoming a very mainstream cultural conversation, and so there's an incredible amount of opportunity in that alone. And so, as you see Field Trip going through our Project Ocean, our spin-off of the clinics and technology
Yeah.
division from the drug development division, we're going to be repositioning Field Trip Health and Wellness not only to be a provider of ketamine assisted therapy and psychedelic assisted therapies, but leaning much more into the cultural movement. There's massive opportunity there. And I think the more people talk about psychedelics as medicine, the more they're convincing themselves that it's only a biotech
Hmm.
opportunity. And that's just not true. I mean, you just have to go outside, walk down the street of Toronto or Windsor or New York or California or just about anywhere, even rural Ontario, it's happening now. Um, Psychedelics are everywhere. So if you don't believe that there's a
Yeah.
massive business opportunity in that, then we have very different perspectives.
What's some of the conversations that you have with government officials? And I've had a lot of conversations with other executives from other companies that say they're very receptive. You're starting to see more and more cities, provinces, for that matter, states decriminalizing drugs because of I think we're starting to get an idea of the ramifications as to what COVID has obviously had an impact on society. Not to sit here and say that mental health was a major issue even prior to COVID, but it kind of fast tracked and brought to light as to how serious this is. But when we look at all the great things that are happening in place, what are some of the day-to-day conversations that you have that you believe the growth of the industry is headed in the right direction?
It really is. You just have to walk down the street. It's almost impossible to go to an event, to go to dinner, to go anywhere in most jurisdictions and not overhear people talking about psychedelics. And it's not, I use the word psychedelic pretty broadly, which is it doesn't
Hmm.
have to mean a Schedule One or Schedule Two or Schedule Three compound. This could be breath work. This could be meditation. There's a number of ways that you can induce a psychedelic experience without necessarily talking about scheduled drugs, but then we see a massive shift happening in terms of decriminalized. I mean, the province of British Columbia effectively decriminalized MDMA, as well as other harder drugs as well. But there's a massive shift happening, culturally, socially, even politically around this. and it's been a part of result of, COVID and the impact of that. It's been in part a recognition that everything we've done in the mental health sphere up to this point has pretty much been a colossal failure. Same with the war on drugs. So I think there's a number of things pointing to
Yeah.
a very significant social, political, and cultural shift around all drugs, but psychedelic compounds in particular.
Are you having personally yourself conversations with elected officials on how they're changing and we're seeing a cultural shift and they're open to the idea?
We well, so one of the things that we've done in response to the evolving market conditions is we've gotten really disciplined. We've really tightened up what we're spending, making sure we're operating as lean as possible. And so, in terms of immediate focuses, government relations and lobbying is not one of them. We're focused on executing in terms of the current regulatory paradigm, but a year and a half ago, when we were doing active lobbying, the reception was remarkable across the political spectrum. Everyone was open-minded and supportive towards
Mm-hmm.
access to psychedelic assisted therapies in controlled environments. We're not talking about, the equivalent of adult use cannabis in Canada, for example, but
Yeah.
something I definitely see, at least within the context of Canada, a paradigm in which something similar to Oregon emerges pretty
Mm-hmm.
quickly. Certainly before I'd anticipate the trials for psilocybin to finalize. Um, and I mean, Oregon should come online early next year. I certainly anticipate that we may see California or Washington or Colorado follow Oregon in that path and creating some sort of legal access to psychedelics as well. So, yeah, I mean, the cultural conversations are following the path that they've been on so many levels, and political conversations as well. There's been no pushback. I've been watching
Yeah.
very actively the media conversations, and it seems like the media is getting a little bit bored with all the good news conversations around psychedelics. So every once in a while, they try and drop a little bit of like controversy into it, but that just gets steamrolled by the positive momentum. And it's not
Yeah.
just with enthusiasm from people like me; it's because there's millions of people every day who have had positive experiences with psychedelics, being like, "Listen, my experience was great," or maybe my experience wasn't that great, but I know a lot more people who had really, really positive experiences than my individual experience, and so they continue to be broadly supportive.
I think a lot of people want to see now is like, how does this industry work? What is going to be the business model and opportunity model? I think like we understand now the data efficacy that's being produced and everybody has that attention. So now it's about getting into action and really understanding what a lot of these business models are going to be, because most importantly, if you have a successful business model, then it's access for people to get better. So saying that, let's begin with recent news where you announced a collaboration with New Life Health to provide ketamine treatments for the comfort of persons' home, which is I found interesting. So, how exactly will this work?
In terms of how the service is offered, or in terms of the
Yeah,
partnership?
as far as the services that are offered.
Yeah, so essentially, one thing that people should understand is that a ketamine is actually an incredibly safe molecule. It's the World Health Organization has just declared it to be an essential medicine, and so even though people often go to the stigma-informed perspectives of ketamine is a dangerous drug, it's not really. Every drug has risks associated with it. There's no
Mm-hmm.
doubt.
Mm-hmm.
Ketamine actually is quite low risk in many, many respects. And so the way this model works is that people interested in our ketamine at home program, well, it's actually called Field Trip at Home, powered by New Life. They would come into the our website. It's actually offered through New Life, so they'd go through the screening process in New Life, assuming the physicians or psychiatric nurse practitioners at New Life feel that ketamine therapy at home would be suitable for any individual. They'll get approved, and then the way it works is you will be sent your first dose in the mail. And then, as part of the experience, you have to have a trip sitter with you, a friend, family member, could be a therapist. You have to validate that person is with you at the time of your experience by taking a photo and sending it in. You have the experience, and then you have access to online group coaching afterwards for integration work.
Yeah. Yeah.
And assume it's a positive experience, assume you comply with the requirements of New Life in terms of validating that someone's present and all that kind of stuff. Then and after that, they'll send you the next two doses. So you'll have an opportunity to do two doses in kind of a row. And that's how it works. So it's essentially ketamine therapy from the comfort of your own home, but properly supported with all the tools, with all the protections and requirements that you need. Certainly, it's not as high touch point or as professional as you'd get coming to a field trip health center, one of our 12 locations, but it's a much more accessible offering. And so, from our perspective, up to this point with our clinics, we've been trying to validate that ketamine assisted therapy can be delivered safely and effectively, that there's demand for it, and then it works. And we've shown that. So now it's about enabling scale. And so this partnership is what enables one of the ways that we're enabling scale.
How effective do you think the at-home model is? Because, like, when I look at Johnson & Johnson's esketamine treatment for depression called Spravato, in which the lack of in-home treatment is frequently identified as a mitigating factor for its lack of success. But do you think the in-home ketamine treatments will be received much more openly by the patient population?
I think there's a subset of the patient population. Yeah, absolutely. I mean, again, a lot of people are becoming very open-minded to psychedelics and psychedelic assisted therapies. But cost and geographic restrictions are a big gating item. And so if you know the safety profile of ketamine, you have the tools and someone present with you to make sure that you have a positive experience. Yeah, I think there's absolutely a lot of people who will be interested, including some people who come to our clinics, go through our protocol, which is 4 to 6 in-person sessions, who then will feel confident to continue on their own. So no, I absolutely think there's a large audience of people who are going to be, who are going to find this a very appealing offering.
When I do look at your clinic model, how many locations do you have now across the U.S.?
We have 8 in the U.S., 3 in Canada, and 1 in the Netherlands.
Are you looking to, as more and more states, like you'd mentioned, Oregon, I know definitely, you're in Los Angeles is correct. So are you looking to expand across a lot of these states? I look at the Numinous Novamind deal, and it actually puts Numinous on the map within the U.S. market and get into states like Utah and Arizona. But with a lot of, let's face it, companies running out of money, you're well cashed up. As of the end of last year, you have $74.5 million. Are you having some of those conversations with people to maybe acquire assets to look for expansion as far as your footprint across the U.S.?
I mean, we'll always be strategic and opportunistic. So if the right opportunity comes up, we'll certainly anticipate it. Our focus right now, taking the advice of Christian Angermeyer, he's certainly not the only one, but his advice I saw it was, the companies that are going to succeed and live through this downturn are the ones that are focusing on reducing spend, getting to cash flow positivity. And riding it out with good infrastructure to be in a position to thrive once market conditions improve. And so that's our focus right now. So if there's a cash positive asset that we could potentially acquire for a right price, certainly something that we're going to look at. But in the meantime, our focus is just getting the best utility out of our existing locations, continuing to build our community through the digital tools that we've built, and driving revenue and cash flows as quickly as possible.
Last thing I want to touch, because you touched on it earlier, just the overall strategy from when we last spoke, and how it's changed, I guess, over the last 6 months. So you, Field Trip, you intend to separate your 2 divisions, which is Field Trip Discovery and Field Trip Health, correct?
That's correct.
So this is for the purpose of unlocking shareholder value. So my first question would be, do you think, I guess, the separation into the clinical and research divisions accomplishes this goal? If so, can you maybe elaborate on that?
Yeah, absolutely. So we're separating the businesses. The clinics and technology division is going to essentially IPO onto the Toronto Venture Stock Exchange under the name Field Trip Health and Wellness. Field Trip Discovery will rebrand as Reunion Neuroscience and continue its drug development work. And absolutely, I mean, there's a number of ways this unlocks value. Very high level one is we've had a lot of feedback over the years of particularly biotech investors not being able to make sense of our business model with this integrated approach. There's a lot of people who sat on the sideline because they just really didn't understand it. So being a pure play biotech with Reunion Neuroscience is going to open up a new category of investor where it's a much more well-established investment criteria, and they don't have to think of the complexities of that model. will be enabling dedicated strategy, dedicated focus, dedicated capital. It's a different investor base between the clinic and technology business and the drug development business. So all of these things, led us to the conclusion as part of the strategic reviews that there's only upside from separating the businesses and almost no downside. The only potential downside that was going to exist was the initial rationale for building this integrated model was there's synergies that we would take from learning about the delivery of psychedelic therapies that could help inform our drug development trials and strategies. And they have already, but we realized that you don't need to have these businesses under one roof, that you can effectively put that into a contractual relationship where there's that data insight sharing, access to our physicians and our therapists to learn about best practices. So we felt like we could maintain those synergies without some of the negative consequences of this integrated model, which I touched on, which is primarily a lot of investors couldn't wrap their head around this structure. And so it gives them much clearer focus, much clearer story, and it enables a much more dedicated investor base that we weren't necessarily speaking to from the early days. A lot of people were saying that there's an inherent built into the field trip valuation because of this integrated model. So separating it should unlock that value.
So since the move or announcement or strategic change, what's the feedback been like as far as the investment community? So they have an understanding now, if I'm understanding that correctly?
Uniformly positive feedback. Also, being able to accomplish and complete a financing in these markets has been seen and as a very positive piece of feedback. It certainly wasn't as smooth as we would have liked by any stretch of the imagination, but we have a great lead investor into the financing to Field Trip Health and Wellness, Oasis Management Company, and so it's been received absolutely positively across the board.
Well, hang in there. I know it's been rather challenging for the industry itself, but I know you guys, diversification, well cashed up, are going to be obviously the main two things to look for as far as long-term growth for companies within this industry. And I know smart to obviously save the money, but at the same time too, maybe not a bad idea either with some companies looking at assets they can buy for relatively cheap right now. But those are some of the trends I think you're really going to start to see with this industry. But regardless, it's summertime. Enjoy the weather.
Thank you.
Hope you and your family are doing well. And I appreciate you checking in and obviously giving us an update. And let's keep in touch, okay?
Absolutely. Thanks so much, Chad. Good to see you.
All right. Thanks, Ronan.
Hey, everyone. Thanks for watching. And if you like this video, wait until you see what we have next. Some of the best thought leaders in the verticals that we cover, from cannabis and psychedelics to cryptos and NFTs and sports wagering. So if you want to learn more, make sure to click on that bell for all notifications. And don't forget to subscribe to our channel. Thanks for watching.